Hi everyone, we are the Doctors Bjorkman, an OBGYN and pediatrician couple going week by week through pregnancy with all of you.
Our goal for the next 30 plus weeks is to bring you high quality medical information about all things pregnancy, while sharing with you what it's like for us as physicians to be becoming parents for the first time.
So for us, this is week 5 of pregnancy, and while we are thrilled about finally getting pregnant, we felt this week it was really important to discuss something that can be heartbreaking and an all too common occurrence in pregnancy, and that is miscarriage.
Yeah. So October is Pregnancy and Infant Loss Awareness Month. And this was recently devastatingly highlighted by Chrissy Teigen and John Lavagin's loss of their own pregnancy.
Yeah.
So them sharing their story was incredibly powerful. And so with that, we thought it was also important for us to take this opportunity to shed a little bit more light on miscarriage and pregnancy loss.
So with that in mind, know that the rest of this episode is all about miscarriage and pregnancy loss, and that can be triggering or upsetting for some viewers. So when you are ready for that information, whether now or in the future, come back, because after this, we are going to talk about what miscarriage is, what to expect, and other common questions women and couples have about experiencing a miscarriage. So this is going to be a heavy episode, but we feel that it is so important to cover miscarriage and pregnancy loss this week. So before we dive into the science and the medicine, we just want you to know that if you are someone who has suffered a pregnancy loss, you have our hearts. You are not alone, and you are loved. I know that I have been with women and held the hands of women as they went through a pregnancy loss, and the grief is unimaginable, and the sorrow and despair is just palpable, and there's nothing you can do besides be there, and it's really hard.
So our hope with this episode is to answer any questions you might have about miscarriage, to bring awareness to this really heartbreaking event, and also to give you the information to understand what miscarriage and pregnancy loss actually is, and so that you can be able to get the support you need if you are someone going through a miscarriage. Also, hopefully along the way, we're able to give you a little reassurance that the odds are in the favor of having a healthy and normal pregnancy.
A miscarriage is any pregnancy loss that occurs prior to 20 weeks gestation. Any loss that happens after that, we describe as a stillbirth, a fetal death, or preterm labor. Miscarriage occurs in up to 1 in 4 pregnancies.
In the case of pregnancy loss prior to 20 weeks, or what's called a miscarriage, there's a couple terms that your doctor may use to describe them. The first is spontaneous abortion. Now this term may be confusing because of the term abortion, but it simply means pregnancy loss, not an elective termination. So an SAB is simply the spontaneous loss of pregnancy. These may be accompanied by bleeding, cramping, and passage of tissue. Missed abortion, MAB, or missed miscarriage. This is a pregnancy that seems to be going along just fine, but then at the time of ultrasound, it is noted that the baby has stopped growing and no longer has a heartbeat. A blighted ovum, or anembryonic gestation. This is by test a positive pregnancy, but at time of ultrasound, all that is seen is an empty sac without a developing baby. There are also ectopic pregnancies, which are a pregnancy that fails to implant in the uterus. They can end up in the cervix, in the fallopian tube, or even out in the abdomen. Without the support of the uterus, these pregnancies are non-viable and may require medication or a surgical procedure to help remove them. A biochemical pregnancy, or chemical pregnancy. These are pregnancies that develop enough to start to secrete that hormone we talked about back in week 3, HCG. However, they fail to continue to grow at that time and then pass with what may seem like a heavy period. These happen so early that you may not even know you were pregnant before they pass. Late miscarriage is a pregnancy loss between 13 and 20 weeks gestation. Remember, if it happens after that 20-week mark, it's termed a stillbirth or fetal demise.
So something I know you're wondering, as I've thought about it myself, is what is your risk of miscarriage? And we know that two of the big factors are maternal age and how far along you are in your pregnancy.
When it comes to maternal age, the risk of pregnancy loss is almost the same for all women less than 35 years of age, being about somewhere between 10 and 15%, or 1 in 8 pregnancies. However, that risk doubles for women aged 35 to 40 to 1 in 4 pregnancies, and then doubles again for women aged 40 to 45, happening in 1 in 2 pregnancies.
Yeah.
The biggest issue at play here is the increased risk of chromosomal abnormalities that occurs more frequently as the oocytes or eggs age.
As chromosomal abnormalities account for about 50% of early pregnancy loss. The other factor that is predictive is the gestational age of your pregnancy, and we can break it down for you week by week what your risk is. The reassuring thing is after a fetal heartbeat is seen on ultrasound, just generally your risk of a miscarriage drops to about 4%. Once you hit the 8-week mark and have seen that fetal heartbeat on ultrasound, your risk drops to 1.6%. And for women, by the time you get to 14 weeks of pregnancy, your risk of a miscarriage is less than 1%.
We want to show you this graph to highlight 2 big things. The first is to again show that the risk of pregnancy loss significantly decreases after the end of the first trimester. The other is, as is unfortunately true in many areas of medicine, the outcomes for Black women are significantly worse than that of white women. There are many things at play in this study, but it again highlights our need to continually work towards improving disparities in medicine.
So it's kind of a weird time of pregnancy, right? 5 weeks pregnant, and I've known I'm pregnant for a couple weeks, and I kind of want to tell people, and I kind of don't. And I think that stems from this fear of miscarriage. You know, it's really common, 1 in 4 pregnancies, and so I think there are 2 camps in terms of deciding if you want to share and when you want to share. And the first is those who say, I'm comfortable sharing because I would be comfortable sharing my miscarriage. And there's the group of people who want to keep their early pregnancy private when the risk of miscarriage is highest because they would want to deal with that grief and processing of the miscarriage quietly and on their own between, them and their partner. I think ultimately, I ended up sharing early because I knew that I would want the support of family and friends because I have just seen how deep and profound that grief and loss and despair can be, and knew I would want my tribe to help me get through that. But you kind of just have to figure out what your heart would want and what is right for you, and whatever that is right.
Another question that many women have is what to expect with an actual miscarriage. It's interesting that with miscarriage being so common, so few women and couples know what to expect. The answer for why this is probably has to do with a lot of how bad we as a society are about talking about pregnancy loss. And so with that, we want to fight back against that a little bit more tonight by sharing some information with you about what to expect with pregnancy loss.
So as we said, most miscarriages occur before 8 weeks. And with those early first trimester losses, it usually starts with bleeding, which can become heavy bleeding, cramping that can be very, very surprisingly intense, as well as some passing of tissue. I know sometimes women are worried, like, oh my gosh, am I going to see a baby? But that's very rare for that to happen, and the risk is really only there late in the first trimester or second trimester. Reasons to call your OBGYN if you think you're having a miscarriage are your bleeding is so heavy that you are soaking a pad front to back, side to side, a big heavy maxi pad for more than 2 hours. If that bleeding is making you dizzy or lightheaded, if the pain is so intense that you just aren't able to cope at home with over-the-counter medication, or if you have a fever above 100.4, call your OB.
And there are other times when medical intervention or procedure may be necessary. This can happen with ectopic pregnancies, missed abortions, or even in spontaneous abortions that don't complete on their own.
Yeah.
And so with this, please reach out to your OB provider if you feel you're having signs and symptoms of miscarriage. It's week 5. We've only known we've been pregnant for 2 weeks and already are dreaming about the life this baby is going to live. And really already love this baby already, which, I don't know, maybe it's a little different for some of you, but for me, just feels so tangible and real. And as we've been doing this episode, I've been thinking about just how devastating loss at this stage would be, or at any stage in pregnancy. And so I guess as one human to another, if that's something you're going through, gosh, my heart hurts for you. And you have our support, and know that you are not in this alone. Also, if you're looking for information in addition to this episode, our good friend Dr. Laura Shaheen, who's an infertility doctor, wrote a great book called Not Broken. It is easy to read, evidence-based. We'll have a link for you guys in the description below if you're looking for something more.
So for the rest of this episode, we want to go through some questions that I get asked kind of frequently as an OBGYN about miscarriage.
So the first question is, if someone has one miscarriage, are they at an increased risk to have another?
So the chances that a woman has 2 consecutive miscarriages is less than 2%. And the chances that a woman has 3 miscarriages in a row is less than 1%.
After miscarriage, how soon could someone try to have a baby again?
So we used to kind of tell patients, maybe they should wait a few cycles, but there's absolutely no data to support that. As soon as you get your period again, you are fine to start trying in the next cycle if you feel emotionally ready. You may be physically ready, but you also want to make sure that your heart is ready for that too.
If someone has a pregnancy loss, do they need to get any certain testing?
So after one miscarriage, we generally don't start a workup. We kind of say it's just a chance thing and bad luck. However, after the second miscarriage, we start talking about running some blood tests to see if there is some underlying problem. The thing is, we usually don't find an underlying problem, but we talk about kind of the pros and cons of doing that testing after 2.
Okay. Is there anything someone can do to decrease their risk of having a miscarriage?
This is a really important thing, and I'll say it 6 times. Miscarriage is not your fault. There is nothing you can do to prevent it or stop it. You did not work out too hard. You did not eat something wrong. Your dog didn't jump on your belly and cause your miscarriage. It's some bad luck most of the time, and it is not your fault.
So that's going to be it for us tonight. If there's any questions you have that we didn't get to, please feel free to let us know. If you've made it through this far in this episode, maybe there's a good chance that this is something that you're going through yourself. Please know that we are there for you, with you. You have our support. And know that this is okay to talk with people about. If you feel like you don't have anyone, talk to your OB provider, send us a message. Please know that you do not need to be alone for this.
We will see you next week.
Bye, guys. We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.